And now it's time for The Doctor Is In.
I'm Meredith Armstrong, and this is The Doctor Is In. This week we have with us Dr. Katrina Roberson Trammell, and she is with USA Health System. She's a pediatrician, and we are here to talk about well visits. Dr. Trammell, thanks for joining us.
Thank you for inviting me. Glad to be here.
Tell me a little bit about what is a well visit exactly.
A well visit is a preventative care visit. In other words, the child is not sick, but they're actually well. And so it allows you to kind of do a little bit more and a little bit more detailed version of the physical exam. You get a chance to spend time with the family, with the children, and you really want to prevent things from happening. So that's why they call it a well visit. Hopefully the child is well, and we want to keep them that way.
Talk to me a little bit about what age children should continue well visits. We know babies are kind of routine, but maybe some people think tweens or teens may not be necessary. What would you say?
I would say it's very important that we see them when they're teenagers, primarily because it's a time to build a relationship. Hopefully you've already had that relationship when they're younger and that continuity of care, but our teenagers are undergoing so much stress, so it gives you an opportunity to do depression exams. You could check on their mental health wellness. Of course, you're going to do the vaccinations that are important for teenagers, just as it is for our babies. So it's really an opportunity to meet them where they are and build that relationship with them.
What else would you like parents to know about well visits, whether it's for a baby or a teenager?
I want them to know, most importantly, that it is important. And the reason why it is important is because you want to keep your child well. I'm a strong believer of primary care and preventive care is the healthiness of our communities. So when you want to go to your doctor, you want to see your doctor, whether it's your nurse practitioner or physician assistant, but you want to be able to have that relationship so that you will know that they've looked at your child from head to toe.
And that your children don't have a fear of going to the doctor.
Exactly. They should not have a fear because they've been with hopefully the same pediatric clinic for a while. But even if they hadn't, you want to build that relationship. And so when you're seeing them and they're smiling, of course, sometimes they get shots and vaccinations, but kids are so forgiving. Teenagers are so forgiving. So that's why you want to keep them healthy.
Thank you, Dr. Trammell. We are going to continue this conversation online to learn more about well visits. Join us there for more of The Doctor Is In.